Director General of the National Agency for the Control on AIDS, Naca, has called for actions on expansion of care, integration of brain health into HIV care for a quality healthcare service delivery in the country. Galaxy News correspondent Shegun Falomo files in this report.
The Director General of the National Agency for Control of AIDS, Naca, Dr. Temitope Ilori, has called for drastic actions on the impact of human immune deficiency virus, HIV, on brain health. She said that although the life expectancy of people living with HIV/AIDS has significantly increased due to the advancement in antiretroviral therapy, neurological complications associated with HIV continues to pose a significant challenge. The Naca DG made the call in a keynote address at the launch of Brain Center and Neuro Rehabilitation Hospital in Ibadan. Ilori spoke on the theme Advancing Brain Health for Persons Living with HIV, a call for action.
Brain is quite significant, and brain health is very key to an individual quality of life and well-being. And there is an association between HIV, AIDS and brain. We have what we refer to as HIV-associated neurocognitive disorders, which occurs when people are HIV positive and they do not use their medications, and they progress into what we refer to as AIDS, advanced immunodeficiency syndrome, and therefore they result to opportunistic infections that can actually complicate the brain, and this can lead to death. So when we have specialized centers like this, the Brain Center, they can complement government.
In a welcome address, Dr. Temitope Farombi, a consultant neurologist at the University College Hospital UCH, stated that 1 in 4 persons has hypertension and also 1 in 6 persons has diabetes in Nigeria, which are major non-communicable diseases that are driving neurological conditions in Nigeria. She called on governments to enact policies that will retain the best hands, which will reduce brain drain in the health sector.
The statistics says that by 2030, Nigeria will experience 3 times the neurological condition we are currently having, like epilepsy, stroke, headache, insomnia, depression, mental health diseases. But then we are positioned to support us, to restore us back to life and to good functions without us having to be disabled in any way.
In their goodwill messages, Mr. Abiodun Latuji SAN and Professor Mojisola Talabi lamented the dilapidated state of healthcare delivery and charged the National Assembly to vote enough funding to the nation's health sector.
Governments can still rescue this important healthcare system from going down finally by pumping money. We need them to seriously pumping money rather than taking the wealth of the country abroad to seek for medical care and treatment. We can look inward. Nigeria, the NSI in Nigeria can also support, especially the University Teaching Hospital in Ibadan. It's so sad that you see doctors moving around the world with the torchlight from their phone, no light. Even in ICU of the UCH, you see individual patients coming up with inverter, to power the equipment they are using.
From Ibadan, Shegun Falomo reporting for Galaxy TV News.